Hello, my name is Lisa Ross, and the presentation I'm doing today is on the topic of post-traumatic stress disorder. I became interested in this topic because I've seen the diagnosis in a number of young people who have experienced traumatic events. I have worked with clients who've had a diagnosis of PTSD, and recently my own daughter was diagnosed with PTSD. She is a female law enforcement officer who has seen a number of terrible accidents, um, recently involved in one about a year ago where her shift partner died in a horrible accident with her by his side before the emergency crews could get there. And as part of her treatment, she went through a process or therapy called EMDR, which I became a little bit interested in and wanted to research for this program. So, with that in mind, let me tell you a little bit about PTSD. Post-traumatic stress disorder is defined in the DSM-5 with a number of categories. There are 8 areas in which you have to meet the diagnostic criteria in order to actually have the official PTSD diagnosis. That phrase PTSD is used in common language a lot, but to actually have the diagnosis, you have to have met a number of criteria. The first is the stressor. You have to have one of the following: direct exposure to trauma or violence, actual or threatened sexual violence, threatened death, or some kind of serious injury or threaten of serious injury. You can have directly exposed to it. You could have witnessed the trauma, learning that a relative or close friend went through a trauma, or just even an indirect exposure with with a lot of aversive, gory details can actually cause PTSD stressor criteria. Now, criterion B, remember I said there were 8, is that this event has to have consistently been re-experienced for you in some kind of way. For example, unwanted, intrusive, upsetting memories, nightmares, flashbacks, emotional distress after exposure to traumatic reminders, physical reactions when you see traumatic reminders. So all of those are part of the second criteria. Criteria C, you have to have one of the two. You can have trauma-related thoughts and feelings and trauma-related external reminders. In my daughter's case, she had both. She had a lot of trauma related thoughts, where every time she closed her eyes or went to sleep, she dreamt about the incident. But she also had trouble with reminders, riding by the highway exit where the accident occurred. Every time she rode by there, and she rode by many times a day in her job, always triggered a reaction, both physical and emotional. Criterion D is you have to have negative alterations in your cognitions and mood. And you have to have two of the following: negative thoughts or feelings that began or worsened after the trauma in the following ways. Remember, you have to have two: inability to recall key features of the trauma, overly negative thoughts and assumptions, blaming yourself, negative affect, decreased interest in activities, feeling isolated, or difficulty feeling good, difficulty experiencing positive affect. Criterion E, you have to have alterations in arousal and reactivity. So, for example, irritability and aggression, risky and destructive behavior, hypervigilance, heightened startle response, which means you jump at a slight noise, difficulty concentrating, difficulty sleeping. Now, all of these factors can be normal reactions to stress right after a traumatic event. Criterion F is a key one for diagnosis because the symptoms have to have lasted for more than a month. Anything before a month could be normal processing by the brain and the body of a traumatic event. However, for PTSD, the symptoms often last for years and for lifetimes. Criterion G, you have to have a functional significance in as part of the criteria. In other words, the symptoms you have to cause you distress, either in your social life or in your occupational functioning. Criterion H just is an exclusionary criteria. That means these symptoms cannot be attributed to medication, substance abuse, some other kind of illness. There are also two specifiers. You can have dissociative specification with either depersonalization or derealization, feeling you're not real or the events are not real, they're going on around you. Now, as far as treatment for PTSD, cognitive behavior therapy, EMDR, and medications, the SSRIs, are used to help people who are dealing with post-traumatic stress disorder. Cognitive behavior therapy seems to work because you're helping folks reframe their thinking about the event. You're targeting or setting a goal, perhaps, to be able to think about the event without excessive blame or anger towards someone. You're able to process the memories. You're able to function or to realize that these unwanted thoughts are creating reactions within your body. EMDR stands for eye movement desensitization and reprocessing. The way it works is in EMDR, you focus on hand movements or tapping while you're talking about the traumatic event. The idea is that the rapid eye movement will make it easier for your brain to process and work through the traumatic event. Focusing on the hand movements or the sounds while you talk the event may help change how you react to the memories of your trauma over time. You also learn skills to help you relax and handle emotional distress. EMDR has four main parts: identification of a target memory and your belief about the trauma, desensitization and reprocessing, focusing on the mental images you're getting while doing eye movements, installing positive thoughts and images until the thoughts of the event are no longer so distressing, and a body scan, focusing on tension or unusual sensations in your body. The SSRIs used are often Zoloft and Paxil. Others can be used, but a combination of CBT combined with EMDR and possibly with medication seem to be the best treatment for PTSD. In conclusion, PTSD is a well-researched disorder. More and more research comes out on it all the time. There are many subcategories to PTSD. There's military, folks that have been deployed and seen action in a war zone. There's law enforcement, first responder PTSD. People have seen really gruesome images and accidents and fires and murders. There are civilians, obviously, who have PTSD from sexual violence, from physical violence done to them as a child or as an adult. There are many, many ways that trauma can be inflicted upon the mind, and it's a fascinating process to study, and it certainly behooves any clinician working with patients to have a good understanding and solid foundation of understanding how to diagnose PTSD, the right treatments for it, and when to help and how to help others. It's been fascinating to study this, and I appreciate the opportunity. Thank you.